COVID tyrants are now calling on the Biden regime to deploy millions of bird flu vaccines. Here comes another scamdemic. And here we go. COVID tyrant Dr. Leana Wen says Biden regime needs to get millions of doses of bird flu vaccines to the American people ASAP. Dr. Leana Wen, the communist doctor who demanded Americans lose all their rights during the COVID pandemic, appeared on CBS's Face the Nation on Sunday to discuss the bird flu outbreak. On Sunday, CBS News rolled out COVID tyrant Dr. Leana Wen to weigh in on the bird flu, and she called for the Biden regime to get millions of doses of vaccines to the American people as soon as possible.
Yeah, there are two main things that they should be doing in the days that they have left. The first is to get testing out there. I feel like we should have learned our lesson from COVID that just because we aren't testing, it doesn't mean that the virus isn't there. It just means that we aren't looking for it. We should be having rapid tests, home tests available to all farm workers, to their families, for the clinicians taking care of them so that we aren't waiting for public labs and CDC labs to tell us what's bird flu or not. And the second very important thing is this is not like the beginning of COVID where we were dealing with a new virus, we didn't have a vaccine. There actually is a vaccine developed already against H5N1. The Biden administration has contracted with manufacturers to make almost 5 million doses of the vaccine. However, they have not asked the FDA to authorize the vaccine. There's research done on it. They could get this authorized now and also get the vaccine out and to farm workers and to vulnerable people. I think that's the right approach because we don't know what the Trump administration is going to be doing around bird flu. If they have people coming in with anti-vaccine stances, could they hold up vaccine authorization? If they don't want to know how much bird flu is out there, could they withhold testing? I mean, that's a possibility. And I think the Biden administration in the remaining days should get testing and vaccines widely available so that at least it empowers state and local health officials and clinicians to do the right thing for their patients.
Dr. Wen, is bird flu in humans super dangerous?
Well, the World Health Organization estimates that in prior outbreaks of the bird flu, that the mortality rate is 52%. 52%. However, in this most recent outbreak, it seems that most cases have been mild, and maybe some people even have asymptomatic infection. But the question is, we don't know what happens when bird flu affects more vulnerable individuals. People infected so far in the U.S. have been mainly farm workers who are working, presumably generally healthy, as opposed to what happens when you get to children, to pregnant women, to older individuals with chronic illnesses. We don't know how deadly, how dangerous bird flu is going to be for those individuals. And again, that's one more reason why we don't want it to spread and acquire more mutations.
Funny how she says, did we not learn our lesson from COVID? Oh, we learned our lesson, lady. We learned that we are not going to be listening to the so-called experts that want to take away our freedoms. We're not going to listen to the so-called experts that want to lock us down. We're not going to listen to the so-called experts that want to pump us up with experimental death jabs. Leana Wen was born in China and served as the president of Planned Parenthood until July 2019. Recall that Dr. Wen repeatedly stated that Americans who refuse to get vaccinated for COVID should have most of their rights taken away.
I absolutely think we should have that requirement. I think it was a major oversight on the part of the Biden administration to not issue this yesterday. And we have to talk about the reason. The reason isn't so much that we need to keep our train travel and plane travel even safer. They are pretty safe, although I definitely think that having a vaccine requirement would make it even safer and probably encourage many people who are vaccinated or who have young kids and want to protect them. Maybe it'll help to encourage those people to start traveling again. But there's an even bigger reason too, which is I think we really need to make it clear that there are privileges associated with being an American, that if you wish to have these privileges, you need to get vaccinated. Travel and having the right to travel interstate, it's not a constitutional right as far as I know to board a plane. And so saying that if you want to stay unvaccinated, that's your choice. But if you want to travel, you better go get that vaccine.
We have to talk about the reason. How about this? When it comes to my freedom, all I have to say to you is come and take it. I dare you. And like clockwork, the usual suspects begin to take to the media. CDC confirms first severe bird flu case with mutations experts sound alarms about potential new pandemic. The CDC has recently confirmed the first severe United States human case of H5N1 bird flu in a 65-year-old Louisiana man who had contact with sick backyard birds. Predictably, so-called experts are now sounding the alarms about the virus's supposed mutations and potential for human transmission.
Concerning new CDC report on the first severe human case of bird flu in the U.S. Samples taken from a patient in Louisiana show mutations that could make it easier for this virus to spread from person to person. Now, right now, there's no evidence it's been passed along to anyone else, and the CDC says risk to the public remains low. But experts warn a single mutation like this could potentially lead to another pandemic.
The virus may mutate and become more easily transmitted person to person. So the more this virus circulates, and specifically co-circulates with human strains, that's going to increase the odds of the virus evolving to more human-to-human transmission. And that of course, could signal another pandemic.
Joining us now is Dr. Deborah Birx. You may remember her as the response coordinator for the White House Coronavirus Task Force in the first Trump administration. We are very fortunate to have your expertise as we try to figure out what's going on with the bird flu and what it could mean. So far, 65 human cases of bird flu have been reported in the U.S. this year, all contracted by animals. But now we have this new mutation in Louisiana. How worried should we be about bird flu potentially becoming another pandemic?
Well, I love the way you said 63 cases, because I have no idea how many cases there were or are, because our number one principle in preventing pandemics is detect. And if you go to the CDC website, you can see that they're monitoring more than 10,000 exposures, but they've only tested 530. What does that mean? That means we're not testing enough. And we know from other viruses that a lot of the spread can be asymptomatic. So we're kind of have our head in the sand about how widespread this is from the zoonotic standpoint, from the animal to human standpoint. Now, also remember, most of those cases described to date happened in the spring and the summer, not when we had H1N1 circulating right now, when we're running the flu pandemic with throughout the United States. So we have rising flu cases, and now we have still zoonotic events coming.
The same old fear tactics out of their playbook. Release the virus, have the experts in the media amplify how deadly the virus is, and then have the big pharma shills calling for lockdowns and calling for mass distribution of deadly vaccines for the so-called cure or the prevention. And if you don't comply, well, you can't live, work, or get a job, or even keep your job. 3 words for these psychopaths: do not comply. Speaking of vaccines, Senator Ron Johnson is now seeking the truth about these vaccines as well. We have to know the truth about vaccines. Right now, we don't. The incoming chairman of the Senate Permanent Subcommittee on Investigations, Senator Ron Johnson, has been vocal about his efforts to hold federal health agencies accountable for withholding critical information about COVID-19 vaccine adverse effects. Johnson is poised to issue subpoenas to the Department of Health and Human Services, the Food and Drug Administration, and the Centers for Disease Control and Prevention, unless they fully comply with oversight demands. Johnson demanded that these agencies immediately preserve and produce all records related to the development, safety, and efficacy of COVID-19 vaccines, noting that the Biden administration's repeated refusal to provide unredacted documents has impeded congressional oversight and endangered public trust.
When the government says a vaccine is safe, is that assurance really based in science right now?
Well, I would argue not really, because we don't have true placebo trials of any of the vaccines on the childhood schedule. They're tested against other vaccines.
Yeah.
So if another vaccine has a certain level of adverse events, you test a new vaccine, has same level, you go, oh, that sounds safe, but we never tested the original one. So again, you have to take a look at, in totality, what is the rate of vaccine injuries? We really don't know. I mean, VAERS, we've had a Harvard study that, prior to COVID, only 1% of adverse events was actually reported to the vaccine adverse event reporting system. So it dramatically understates the number of vaccine injuries. So that's a problem. It's very difficult because there's money on the line. In order to get compensated, you have to prove that whatever health condition you have was caused by a vaccine. There's such a reluctance within the medical establishment, within our federal agencies, to actually link a vaccine to any kind of health outcome. So we've paid out very little from the vaccine injury compensation fund, virtually nothing to the one designed for COVID. The best solution for this is actually make these products safer and do real science to determine, are there certain conditions that make you more vulnerable for an adverse event? Again, we haven't even been able to ask the question because everybody in the industry just wants to rely on the safe and effective rhetoric and look no further.
Big Pharma knows how dangerous these vaccines are. They know the side effects. They know the risks. That's why they are severely redacted in any papers that this government releases about them. They know the truth, but that's why they hide it. They care more about the payout. They care more about the profit. And that's why it's hidden. And anyone that tries to look into it or bring it up gets neutralized and silenced. And at the end of the day, regardless of what happens, our freedom shall not be infringed. My name is Drew Hernandez for the Gateway Pundit, and you have been on watch with Drew Hernandez. I'll see you guys on the next one.